Thanks very much, Dermot. My name is Niall Roche. I'm, like Dermot, a member of the Irish Forum for Global Health. We're a network, I think, of somewhere around 700 people who are interested in global health. Some of us are health professionals, some are not health professionals, but we all have kind of a passion for global health. And I suppose within the Forum for Global Health, we had a meeting on the board there back in, I think, February or March, and we felt that this was an issue that we should be raising. And part of the objective, I suppose, of today is, as Dermot said, what the Irish Forum for Global Health wants to do is to ensure that we at least communicate or share some knowledge about the topic of climate change and health. Maybe in Ireland we tend to talk about climate change with respect to food security and land use, but what about the effects on the human population? And the other thing too is to bring people together. We were at an event last night called Convergence, and I suppose we want to converge or bring people together and to connect and to network and to share ideas and to work together on the entire issue. I suppose I have many thank yous to mention. This is not just an Irish Forum for Global Health. There are many different partners who have been involved in organising this and also in funding us. The Ryan Institute, who you can see over here, have been heavily involved in it. We have Trócaire, who has specifically funded us. The Development Studies Association of Ireland have also funded us. And we've had involvement with a number of other institutions. Let me just see if I can find their names. The Ryan Institute, Trócaire, DSAI, the HSE, Cultivate, the Galway City Community Network, and the Irish Forum for International Agricultural Development. Okay, so many, many people have been involved in this. In terms of the context, I suppose, as we said, today's focus is both global and local. We also want to talk about the threats that climate change pose to health, but not all doom and gloom. We also want to talk about the opportunities. There are huge opportunities for us as a global population in terms of what we can do in terms of protecting and promoting health. I don't want to speak for too long. We have a packed programme. As you can see maybe from the programme, we have 4 speakers this morning, each coming from a diverse number of backgrounds. A couple are coming a long way, from as far afield as Australia, maybe not immediately, and the United Kingdom and other parts within Ireland. And we will try and stick to time. So the first speaker will speak for 30 minutes and we'll have 15 minutes of questions. Then each of the other 3 speakers will have 20 minutes continuously speaking, and then hopefully we'll have maybe 20 minutes or so for questions and answers at the end. So apologies on my part. As you know, organising these types of events is difficult when not everybody has their own particular job, so I'm sure there are some mistakes that we've made. You'll hopefully get an opportunity to give feedback to us. We appreciate feedback during the day on a verbal basis. And Steve, who you may have met outside, he will also try and send you an email, and you can provide us email feedback as well in terms of what we did well, what we didn't do so well, and more importantly, what we want to get out of this is that this is not the end of the discussion on climate change and health, but what can we do in terms of going forward. I think today is quite a broad focus on the whole topic, but maybe we can have more focused discussions on particular issues. Like just for example, in terms of myself, my own profession is environmental health. I work as a consultant on environmental health and water sanitation and hygiene in humanitarian contexts and more development settings. And I have a particular passion on the issue of air pollution and indoor air pollution or household air pollution in particular. And just to give an example, I went to South Sudan a number of years ago, and I went into someone's home. I love going into people's homes. You're very privileged to get into someone's homes. And there was a woman there and she was breastfeeding her baby. Her baby maybe was 4 months old. And in terms of health-seeking behaviour, you say, that's fantastic, that's what you want to see. But as soon as I walked into the túchel or the house, my eyes were beginning to stream, my lungs were beginning to cough up because they just finished cooking inside the home. And there was a huge number of pollutants in the room. And I'm thinking to myself, yes, in terms of health, yeah, we've got some behaviours being done correctly, but there are other aspects in terms of protecting this child's health that are not being followed through on, and we're not maybe connecting the dots, so to speak. So that's from my own perspective, some of the issues I'd like to see going forward in terms of global public health. The other aspects to the context of today not today, but Tuesday is World Environmental Health Day. I don't know if you're aware of that. It may not be as well known as World Toilet Day, which occurs every year in November. That is not a joke. There is a World Toilet Day. And the theme this year is on indoor and outdoor air quality. Another thing to reference is a thing called the Geneva Pledge, which the Irish government signed up to in 2015, where we kind of recognise that we cannot overlook the injustice faced by the poorest and the most vulnerable people in our world who are disproportionately affected by the impacts of climate change. So we as a nation have said that we will not overlook the injustice associated with climate change. There was one other thing I was going to mention, but I've forgotten. I think it's the Ministerial Declaration on Health, Environment and Climate Change, which was signed following the Conference of the Parties in November of last year. And it says that we have an important opportunity for action in terms of addressing climate change from a health perspective. Okay, I'm not going to wander on any longer because I'm all over the shop. I'm going to introduce our first speaker, Nick Watts. If I can find his bio now, is the next thing. Nick is the Executive Director of the Lancet Countdown, tracking progress on health and climate change, an independent and multidisciplinary research collaboration between academic centres around the world. He is based at the University College of London's Institute for Global Health, and this is a continuation of the 2015 Lancet Commission on Health and Climate Change. The Countdown tracks and drives progress towards a world which is responding to climate change in a way that protects and promotes health. Nick is a medical doctor by profession, having qualified from the University of Western Australia and trained in population health and public policy. He also works as the director of the UK Health Alliance on Climate Change, which brings together the UK's major health institutions, including the BMA, the Lancet, the Faculty of Public Health, and the Royal College of Physicians, Nursing and General Practitioners. The Alliance aims to support the health profession and engage government in accelerating a transition towards a healthier climate. So many thanks, Nick. You're very welcome.